move out of the way. Don't push with your arms because that's going to cause damage.
How do you defend yourself if a patient tries to kick, punch, or hit you? How do you stand? How do you move away? What do you do with your hands? What if a patient grabs your wrist? Well, first of all...
Christine, please let go. Huh? Christine, please let go.
And if that doesn't work?
I'm going to tuck. I'm going to twist so my arm isn't that way. And then if I want extra support, depending on who the individual is, I can put my other hand on top and twist out.
There are many techniques that frontline hospital staff who have direct contact with patients are taught to employ when they're confronted by an aggressive patient or family member. But here at Michael Garron Hospital on Coxwell Avenue, the annual training focuses on preventing a confrontation from getting to that point. Sometimes a simple distraction technique will do the trick, all part of keeping staff safe without harming the patient.
It's all about prevention, and a lot of the program is about prevention.
Some other basic tips to keep staff safer: don't wear scarves or jewelry. Don't wear hoodies with strings. Keep your hair up so it can't be pulled. And also, the lanyards they wear separate easily so they can't be used to choke.
Most people who become violent, they're not in their right mind, but it's not necessarily mental health. It could be dementia, it could be delirium, it could be stress, it could be fear. There's a lot of reasons that somebody might get to that point. It could be a reaction to a medication.
When a staff member feels like they are in danger, they can call a code white, which will bring immediate assistance.
Hi, Kevin. Can you come right away? We need your help.
Yes, I'm on my way. I'll be right there.
But at MGH, they also have something called Vocera. It's a two-way radio device that can communicate directly with security. Nurses and other staff tend to use that first to summon help. So while they have about 100 code white calls a year, that's fewer than some other hospitals which don't use the Vocera technology.
One of the main things that we emphasize in our training is keeping calm. Sometimes it's hard because a violent situation can be very frightening, so it can be difficult, yes.
Right. Stats show that nurses in particular face more incidents of workplace violence than even police officers. Nevertheless, the goal is to de-escalate.
We learn strategies on how to communicate with the patient, find out what is happening and how to find out what the needs are. Because sometimes the situation arises from unmet needs.
Like many hospitals, Michael Garron has a zero-tolerance policy for all forms of abuse. But as officials point out, it is a balancing act because the hospital has a duty of care for both staff and patients. In East Toronto, I'm Pam Seatle, City News.